just improve my posture with a brace? I think that's such a good question because there's so many different braces out there specifically for correcting posture. And then, of course, you have braces for, when you've sprained an ankle or your wrist, and there's those kind of braces out there too that a lot of people tend to go through when something's hurting. How would you answer that if you had someone that asked you, can I just use a brace to fix my posture?
Yeah, and I think we do get asked that a lot, right? Especially on Instagram. If you follow Egoscue, I think you get targeted with the ads for the little brace that you put on your back and it zaps you. And so, like you said, there are different kinds of braces, like a brace that just pulls your back for you and holds you in place isn't really going to do anything except make you look good when the brace is on, because we're never going to actually train the muscles that are supposed to turn on to pull your shoulders back and down or to pull you out of that forward posture. So that kind of brace, I would say, doesn't really do much for you. There are these little zapper braces. And they zap you when you go into poor posture, which is similar to, I guess, dog training. I will say, though, I don't think most people would like using one. If you're going to use any kind of brace, I think they're probably your better bet, because they tell you when you're out of alignment so that you can kind of pull yourself back. But there's also, then you run the risk of doing it with the wrong muscles and kind of faking good posture and not really retraining, because it's only seeing your shoulders. So if only your shoulders are your problem, then that'll work for you a little bit. But as we know, most people don't have just one load joint that's not being loaded properly. So maybe the issue's coming from your hip and you might pull your shoulder back to stop getting zapped. Yeah. Then your body is contorted in another way and you run the risk of giving yourself a new problem. Right. So in general, braces are not awesome. I think the one or two times that they can be good is if you're recovering from an injury. Absolutely, yes, use a brace. Not so much the kind that come up here, but a lot of times people need abdominal braces if they've hurt their back or after they've had a baby. And I think you should look at a brace as a short-term situation where you can get through whatever activities you need to do. And then after you're through them, you need to retrain your body properly and strengthen the right muscle.
You answered it well. There are so many different types of braces out there and different tools. And you basically touched on exactly what I was thinking about, like those little buzzers, and those are good for awareness, like you're saying, but they are not fixing the problem, because if you have to keep being reminded, then obviously that means your muscles haven't been trained enough for you to keep that position subconsciously, and that's the work that we do with our clients, right? Is taking a look at their body, getting a personal assessment on what's going on, why they have poor posture, and then knowing what exercises they need. On the other end, we can do all of that, but the clients are doing the work. They're showing up every day, doing the exercises, and that's what's going to make it stick. The consistency and doing it every day is what's going to make it stick. But yeah, I totally agree with you, and I tend to answer that question very similarly, because people are sometimes in a situation where they don't have the luxury to take time off of work and they're hurting, and maybe their work is more physical. If you need to wear a brace because it helps you get through your work shift, I'm not going to tell you not to do that, but just know, like what you were saying, it's a little short-term effect, right? Just know that it's providing some comfort for that moment, but you still have to come in on the back end and do the work to retrain the muscles so that you don't end up in that position again where you're in discomfort. So it's more important to discover what's the root of the problem. Why are you always slumped over? And it's not just because you're always sitting, or it's not just because you're always doing XYZ. Obviously, those are factors, but sometimes there are parts of your body, joints and muscles, that are not doing their job, And so you need to retrain them to remind them what their job is. And then that's where you're going to get those sustained results. So yeah, I definitely agree with you there. It can help in the short term. And if that's what you need to get you through your day, fine. But let's make sure we're doing all the work on the back end too.
Right. Or else you're just going to buy stronger and stronger braces.
Yeah. Right.
And
And
always,
that's so true. The other thing too, I was thinking is that the braces kind of force your body like locked into a certain position. That also assumes that your body can get into that position. You know, kind of like even when we're talking about like what's the right chair and you want something with lumbar support and you know, you have these chairs that kind of push your lumbar spine into extension. I understand the purpose behind that is to get the curve of the lumbar that we're supposed to have, and I agree that that's needed. But if someone's been in dysfunction for so long and that part of their spine doesn't move that way, that's probably not going to feel good. And this like really great ergonomic chair or brace or whatever doesn't actually feel good anymore. So on the other end, if you wear a brace and it doesn't help you and it doesn't feel good, don't wear it.
I think you did hit on a good point coming away from braces, just about things that sort of force your body into position, like lumbar rolls or special seats.
Mm-hmm.
Every individual is different, and that's why knowing where your body's misalignment or dysfunction is so important. And you can try a variety of things to see what
Mm-hmm.
feels right, and sometimes that's the best way to do it.
Mm-hmm.
But just there isn't a one size fits all brace or seat, because like you said, a lot of people would go into having more symptoms or more pain if they used
Mm-hmm.
one of these ergonomic proper chairs. You
Mm-hmm.
have to know what your body needs and what it's ready for, what it can
Mm-hmm.
accept at the time.
Mm-hmm.